Welcome to Counterpoint. I'm Tanya Granick-Allen. Mental health is an ongoing concern for many Canadians, especially since COVID. Many Canadians, upwards of half, are deemed to be at risk of mental health issues, yet fewer than half of this number are willing to even discuss it. And of course, we think of the youth who seem to have borne the brunt of COVID lockdowns and who have struggled through the crisis. So what exactly is the state of mental health in Canada? What resources do Canadians have? With an upcoming Ontario provincial election, will mental health receive the attention it deserves? Well, joining me now to discuss all of this is Sarah Kennell, National Director of Public Policy with the Canadian Mental Health Association. Sarah, thank you so much for joining us today.
Thanks for having me.
Yeah, this is such an important conversation to have. And I've tried in the past couple of years during COVID to really touch base with this issue to see how Canadians are doing to get a pulse on the situation. But now, as we seem to be emerging from the sixth wave and hopefully the last wave, we always hope it's the last wave, I think we're kind of looking at now at the remnants of what's left with Canadian mental health and how are people faring now that we're kind of hopefully on the other end of the side of this, of COVID. So maybe you can start us off by saying, what is the state of mental health of Canadians right now?
Yeah, as you mentioned in your introduction, tens of thousands, if not millions of Canadians are reeling from the impact that COVID has had on us. What we're experiencing is pandemic fatigue, really. It's the mental health impact of living under 2 years plus of changing public health directives, lack of social connection, and limited access to mental health resources. So prior to the pandemic, really, we were accustomed to being able to access services in person and be able to, foster connection in person with community, which is so important for maintaining good mental health. And all of those opportunities kind of were shut down in the early days of the pandemic. And what our research is telling us is that has had a devastating toll on our mental health overall.
Now, I agree with you. I remember we had someone else from one of your local regional areas from the Canadian Mental Health Association, and she said that first lockdown, which, in Ontario at least, did extend quite a lengthy amount of time, is that a lot of those programs were shut down very quickly. We all, stayed home for those 2 weeks, and then it kind of extended from there. I did think it was wonderful, however, that quickly things did pivot to at least doing online and virtual. But you mentioned that we need that interaction, that there's an importance of having in-person interaction. Why is that so important?
Yeah, the pandemic has really showed us it's a tale of two pandemics when it comes to virtual care. For some, virtual care has been an incredible opportunity, particularly for people who live outside of major cities, who can't necessarily travel into town to get an appointment with their healthcare provider. So the virtual care has been incredible for that. On the other hand, many people who don't have access to a cell phone or, strong internet, reliable internet, a data package, those types of things, online care is just not going to work for them. And including those who have different anxiety, mood disorders, or those who require in-person care. And it's often the most marginalized in our community that need that in-person care. So, it's been a positive and a negative, the virtual care, but social connection isn't just about access to healthcare. It's actually about building skills around empathy and compassion and understanding. And we need that more now than ever in our society. And that's why the in-person connection is so important.
And especially for those who have certain mental health diagnoses, there are group programs, and it's really hard and challenging to have a group wellness program run over Zoom. I mean, you're dealing with a screen could have 15 persons on it. I mean, that is overwhelming for those of us with perfect mental health or ideal mental health, let alone those who are struggling. So I do recognize that it is important to have that face-to-face contact, especially for some of those group programs. Could you give us an example of maybe some of these group programs that are so important and why?
Yeah, absolutely. So we're talking about, art therapy programs. We're talking about group therapy. We're talking about food boxes and employment services that are often done in a group setting, providing supports, that extend beyond the delivery of traditional mental health supports, but really include what we call the social determinants of health. So things like where to find affordable housing and how to apply for a job, how to write your CV, So we're providing support to people with, severe or persistent mental illness who need that personal connection to be able to manage their illnesses and be able to thrive in society. And that's where the in-person stuff has really taken a toll.
Okay, we're going to take a break. We'll be right back. Welcome back. We're discussing the state of Canadians' mental health and what that looks like now, especially as we emerge from COVID. And joining me to have that discussion is Sarah Kennell, National Director of Public Policy with the Canadian Mental Health Association. So Sarah, obviously, with COVID, it impacted everybody very differently. If you were a teenager, you probably would have been very upset with some of your programs and schooling changing, never knowing kind of what's going to happen from day to day. If you were someone infirmed or perhaps in an LTC, there was I would assume, a lot of loneliness there. And then you have the parents trying to keep it all together, working while schooling. There was a lot going on. Maybe you could share with us how you saw different cohorts impacted in various ways during and post-COVID.
Yeah, absolutely. What we saw is really an exposing of gaps that already existed prior to the pandemic in terms of discrepancies in access to healthcare services and mental health supports in particular. So, the folks that we would consider to be marginalized prior to the pandemic, whether it be racialized folks, LGBTQ2 folks, Indigenous peoples, unemployed, people living with an existing mental health condition, they're the ones that we saw in our research to be most likely to experience a deterioration in their mental health as a result of the pandemic. What we also saw emerge during the pandemic was a real important focus on what we have come to describe as the sandwich generation. So parents who are caring for young children or school-age children, in addition to caring for aging parents. So as you mentioned, parents who are entering the long-term care or retirement residence situation and really having the double burden of having to care for people at both ends of the spectrum age-wise and not being able to see them in person or them being located in other geographic parts of the country. And that population has been incredibly impacted from a mental health perspective. We also don't yet know what the impact will be on our young generation. So people or children born post 2020 and the changing environment of socialization and childcare settings, we don't yet know what the impact will be. And of course, as you mentioned, with school age children and teenagers, those finishing up high school and applying for university, these are the populations that we're monitoring very closely. And we've already seen heightened levels of depression, anxiety, suicidal ideation, and eating disorders in particular.
Yes, I can say just from personal experience, hearing from friends and stories from friends of friends of suicides of children, young teens or later teens who've taken their life or who've, it's been a lot. And, I didn't think about mentioning this, but even surrounding the vaccine, I mean, it was a very polarizing issue for some Canadians. And, there were some Canadian students who elected not to procure or not to get the vaccine, for example. Well, they found themselves quickly de-enrolled. Their life kind of crumbled before them very quickly. I always wonder how that would have impacted. I mean, yes, I suppose ultimately it's a choice, but I can imagine that must have been hard for a lot of young college and university students.
Absolutely. And also challenging from a parent perspective when you're making choices on behalf of children regarding vaccines or masks. These are really difficult conversations to navigate among parents and among children. And so having the skills to be able to navigate those challenging conversations is really important. The theme for our Mental Health Week 2022 is empathy. So being able to understand where someone else is coming from and being able to put yourself in someone else's shoes. I think these skills are so important now, considering the divisions in society that we're grappling with. I think, empathy is really key for those conversations.
Yes, and I'm glad you brought up Mental Health Week. I should mention we're doing this show actually because of its Mental Health Week. So I appreciate that. I know you're very busy, that you made time to come on to discuss this. Empathy, what an amazing theme for this year, because we've seen a lot of language and politics of division and a very us versus them mentality in the past couple of years. And it's important to kind of really understand, take a moment to pause and say, how can I understand where that person's coming from? And do we need to really have this kind of discussion so polarizing? Can we find a better way, perhaps?
Exactly. And it can be translated at so many different levels, whether it's the halls of the House of Commons or Senate, or just the halls of school or in our communities. You know, we live in diverse communities that with people who hold diverse political views and other views, and being able to break down the barriers that are seen to divide us can be really helpful, particularly when we start to navigate the way forward. We know we're not returning to normal. We are creating a new normal. And if we're going to do that, we're going to have to work together, and being able to understand where we're coming from, and to be able to put ourselves in other people's positions and try and negotiate what those common grounds look like, I think is the key to moving forward post-pandemic.
Okay, we're going to take a break now. We'll be right back. Sarah, we recently had a federal budget. The Ontario budget will have just been released by the time this program airs. We know there seems to be more money being thrown at mental health, which is in some ways a good thing. But how and in what way, and is it the right way to help the problem or help alleviate the Canadian need? What do you feel is being done well? And we could split up federally and provincially, but how do you think the feds are handling the case of mental health, and what are they doing well? What could be improved?
Well, I think as a starting point, it's really important to recognize that there's cross-party support for mental health. So we're seeing all parties come to the table with a commitment to do something. The question is what we do and how we do it. And, you know, the Liberal platform included some very ambitious commitments around establishing a national mental health transfer and new mental health service standards. We see these as two important things. The question is, what do they look like, and when will they be implemented? And, you know, the mental health transfer, the big conduit through which we would want to see the federal government invest in provincial and territorial health budgets, was not in budget 2022 at the federal level. So we think that's a missed opportunity, and really one that we want to see a timeline on to create as soon as possible, because we know that provinces and territories are only spending about 5 to 6% of their provincial budgets on mental health, and that's just not enough to meet the rising need.
No, absolutely. I can, tell you so many stories of friends saying, my daughter needs a program, or my friend needs a psychiatrist or a therapist. Do you have any referrals? I said, well, as terrible as it sounds, get in line. The lines are so long, but yet when one is struggling with mental health, it's not something that can be treated in 5 months down the road. It really needs immediate treatment. So I worry a lot about, again, not just the state of mental health of many Canadians, but also what programs are being developed to meet their needs. Mm-hmm. And not, like you said, not in the future, when will it happen? It needs today. So provincially, say, for example, the province of Ontario, because we are headed into provincial election, tends to be the time when, as I say, a lot of candy is given out and there are a lot of opportunities. And since there is cross-party support, what do you think the provincial government of Ontario has done well, and where could they improve upon, and what you might see during this election cycle?
Yeah, one thing that's been really positive in Ontario is the commitment in investment in community mental health. So, that's recognizing that we're not all going to need help in hospitals and emergency departments, psychiatric wards. Really, as you mentioned, it's families who are looking to support their kids or teenagers who are experiencing challenges for the first time. And the importance of investing in mental health promotion and mental illness prevention, it's that care before crisis mantra that we really want to see scaled up. And Ontario's done a great job of investing resources and infrastructure into those community-based resources. However, we know that it's not enough. We know in Toronto, for example, there's been a 300% increase in demand for early psychosis intervention programming delivered in community. And this is in Toronto and Ontario, one of the most well-resourced provinces in the country. So you can imagine what the barriers are across the country. So we're looking to the budget, the Ontario budget, to see greater investment in those key mental health promotion, mental illness prevention interventions.
You mentioned that parents, I'm a parent myself, maybe you are as well, but parents, they really want the resources, or they really want to be able to support their child. And, parents are busy working. And again, in COVID, it's been a very fluid and changing environment with work at home, not at home, children in school, not at school. But some parents are caught off guard when I mean, I'm sorry to say, but the child just seemingly snaps one day, but perhaps there were some signs all along, and the child's in crisis. And you mentioned care before crisis. What could parents be doing, or what could they be doing to help their children's mental health at this juncture, knowing what they've just been through?
Yeah, it's a big ask because, parents themselves have been under so much stress and change, whether it be job loss or housing affordability. We as parents, I'm a parent myself too, we have a lot on our plates. But it's important for us to integrate, throughout the life course, social and emotional learning. So supporting that in school, but supporting it at home. It means talking about emotions, being able to identify emotions and creating opportunity to talk about those as a family. Of course, easier said than done when you're in a crisis situation. When you're in crisis, it's always important to turn to local resources, whether it be parent groups informally, reaching out to your social networks to ask for support, but also turning to children's hospitals and local community-based mental health organizations who, if they can't provide immediate service, at least can point you in the right direction.
Okay, we're going to pick up this in just a few moments. Welcome back. We're joined by Sarah Kennell, National Director of Public Policy with the Canadian Mental Health Association, as we are headed into Canadian Mental Health Week. And we wanted to do a show to highlight this, and especially now that we're emerging from COVID, what are we left with? So much of, definitely the program today, and so much of my focus has always been on the user side of the healthcare system. How are parents coping? How are the children surviving? How about the LTC resident? How have they survived? What is the state of their mental health? But we sometimes forget about those who actually are providing the healthcare, the mental health workforce themselves. Could you share with us, how things were pre-COVID and now where things are, and how we could, again, ameliorate the situation?
Absolutely. And it's so true. We often forget about the people who are taking care of us. And it's so important for us to shine a light, especially now that we've seen what they've been going through. So pre-pandemic, we knew that there were wage disparities and workforce shortages in terms of retaining and recruiting qualified staff, particularly in the community mental health sector, so outside of hospital settings. What we saw during the pandemic was really that escalated. And as a result, now we're really facing a lot of burnout, a lot of compassion fatigue, and a lot of stress from the perspective of the health sector pulling resources from the mental health sector in order to cover vaccination clinics and other shortages that existed across the healthcare setting. So we're really in a bit of a dire situation when it comes to kind of sustaining the mental health workforce.
Wow, I wasn't aware of that. So during, I guess, the rollout of the vaccines, people were seconded to,
That's exactly it. Yeah. So you'd kind of have mental health care providers wearing three hats, homeschooling their kids on the side while delivering mental health care during their day job, and then in the evenings working at vaccination sites. So
my goodness,
we really, as a result, have seen so much burnout and exhaustion, and it's really created a situation where it's been hard to retain and attract new staff.
Now, there's a bit of a departure from what we're discussing now, but one thing I've noticed over the years is mental health just never seems to get the attention and the funding or the recognition it deserves. Now, I know things are changing in the right direction, but why is it that mental health or addressing mental health issues or talking about it is just so challenging where, if you have a cancer diagnosis, people will talk about that, or if it's easy to perhaps treat a broken leg. Why not mental health? Why is there that stigma surrounding mental health?
Yeah, it really is rooted in that stigma, in that, it's difficult to comprehend and, grapple with changes in our mind and changes to who we thought we were and who we thought our community members were, our family members were. And that's why it's been such an issue that's been kept in the personal realm that hasn't been openly talked about and addressed. And we've seen great strides in terms of awareness raising campaigns, destigmatizing campaigns. But sadly, that hasn't transferred to strong political commitment and investment. So now that we are more openly talking about, issues like mild to moderate anxiety, depression, and stress, it's great. But until that translates into actually better access to care, we're not going to see the change that we want to see. And sadly, the stigma is still incredibly high, particularly people with mental illnesses. So, bipolar disorder, schizophrenia, major depressive disorder, these types of illnesses remain incredibly stigmatized within the broader mental health space.
Oh, that's really sad, but I do hope things will change. Is discussion enough important? I know we want more funding, more programs, but is really just talking about it more, and I know there's Bell Let's Talk Week. I mean, is talking about it more, does that really help drop the stigma?
Absolutely. What we're seeing is workplaces can be incredibly powerful spaces where stigma actually reduces in a positive way. So, programs like Not Myself Today that, actually you have buttons where you say, I'm angry, or I'm sad, I'm frustrated, I'm happy, I'm hopeful, opens the door for conversation in the workplace where we spend a lot of our time. So if we're able to destigmatize mental health in the workplace and kind of meet people where they're at and have the conversations that are challenging, but also really important to have, then that's where we move the needle on mental health.
And I think that ties in nicely with the theme of empathy, which one more time is the theme of the Canadian Mental Health Week. Sarah, it's been a pleasure. Thank you so much for joining us today.
Oh, thanks for having me, Tanya.
Best wishes. If you are someone who is struggling with their mental health, and let's face it, so many of us are, please don't hesitate. Reach out to someone, tell someone, because I do agree if we speak about this a bit more, then we will reduce the stigma. And absolutely, there are many Canadians who definitely need the help. For Counterpoint, I'm Tanya Granick-Allen.